Welcome to NTH and Hartlepool Voices, telling the stories of our people and community in our trust.
So hi and welcome to NTH Voices, our new podcast. I'm John Hugel from the Communications and Marketing team. I'm joined by Hayley Douglas, our alcohol lead nurse.
Hi.
How are you doing today?
Good,
okay?
Yeah, you?
Excellent, yes, very well, thanks. So I've just got a few questions to ask you. So can you tell me first of all a bit about your role and the role of the wider alcohol care team?
Yes, so the alcohol care team's made up of myself and another registered nurse. We have 3 Band 4 associate practitioners. We see patients all across the hospital, from A&E to patients that are waiting for operations, if they need any support with their alcohol withdrawal management when they're in hospital. We've been around since July. I've been around since April last year, but we've actually only been live since July, and the team's just been coming in slowly throughout the year. We're fully staffed now and we're fully operational, so we do Monday and Friday 8 till 6, and weekend and bank holidays we do 8 till 4.
So like you say, the team was set up in July, so that's nearly coming up to a year now. So what would you say have been the main challenges and achievements over that time?
I think we're still embedding in the trust, really. I think not all the staff know that we're here, so hopefully doing this will help. So we're not getting a true picture of how many of our patients are coming through the hospital doors who actually have an issue with alcohol. The government recommends that you don't drink any more than 14 units a week. So everybody really should be screened for that when they're coming into hospital, and patients aren't. So it's kind of our job to embed that into the trust, but that's an ongoing piece of work, really. So we're catching as many patients as we can, but there is still quite a lot of patients that we aren't getting hold of.
So as we know, Teesside has some of the highest rates of alcohol-related deaths in the country, with Hartlepool being the 3rd highest, I believe. Why do you think this is, and what challenges does this represent to the team and to those people affected?
I think the pandemic has got a lot to answer for. We are still not seeing the full aftermath of that. Like, the sales of spirits and wine was up by millions. So I think all these patients are now starting to filter through. We're even seeing patients that have never been to a GP for 10 plus years, and they're coming into hospital with like end stage liver disease. And I think the fact that they have been in their house for years and done nothing but drink alcohol is massively impacted on that, like on the whole population, really. And then in turn is loneliness, which leads to your mental health problems.
Quite a multi-layered thing. There's lots of different reasons, I suppose, why someone might get to the point where they come into hospital with an alcohol-related problem. Yeah,
I mean, like, even falls. You know, if you're at home, you've had too much to drink and you have a fall, and then they've had a long lie. We're seeing lots of those patients. A lot of our patients come in with chest pain as well. In regards to what's going on, like, with the community and how we're working, so Stockton and Hartlepool have both the councils have just written a report on their drug and alcohol needs assessments, which we are being part of as well in regards to writing out the recommendations for that. And it's quite interesting, actually. When you look at the map on Hartlepool, there's specific areas where the hotspots are, and those hotspots tend to be the more deprived areas. They tend to be the areas that have the more your 24-hour places where you can get alcohol 24 hours a day, basically. So they're going to look at things like not being able to get more licensing around in them areas.
So how do you think that'll help then with licensing? If we do make those changes and find those patterns where in those areas.
Interestingly, Scotland actually have done something very similar to what we're proposing in our area. They've even put, on your bus stops and things like that, the posters about not drinking too much. I'm sure a lot of the places in Glasgow, they stop selling alcohol at 10 o'clock, and they've seen a massive reduction in their alcohol-related hospital admissions. So that would be amazing if we could do something similar in our area. It's getting all that pushed through though, but that's working with our community partners to do that.
Sounds like very interesting work, and I'm sure we'll hear more about it over the next few months. So just finally, have you got any new developments and events planned over the next few months, and any key messages for our listeners?
Yeah, so we have put on another clinic for our fibre scans. That's on a Thursday morning over in Hartlepool. We continue to do the Friday morning ones here at North Tees. Our AA meetings obviously are in the chapel every Tuesday, 4 till 5. All are welcome to that. So that's like family members, patients and staff. We are doing a 1-year on event in July, which is open for all staff. That's going to be in the lecture theatre. So keep your eyes peeled for an email about that and register your place. People on the agenda will be people from our liver disease training, Norgine, and our Pabrinex represents.
Just for our listeners, what is fibro scanning? What's that?
So fibro scanning is it's not an ultrasound, but what it does is it is a scan, but it kind of like sends vibrations to your liver and it measures the stiffness of your liver. So if your liver is a little bit stiff, that would probably indicate that you've got a fatty liver. If it is really quite stiff, you would be looking at more of a cirrhosis of the liver, which would need ongoing management really. But your fatty livers can be turned around, and they're the patients that we want to be seeing and getting really, so that we can put some support in place for them around their drinking, exercise and diet.
Is this a brand new development for a lot of NHS trusts? Is this quite a new thing?
For the alcohol care teams across the country it is, yeah. So it used to be a sequin target, fibre scanning. It was last year, but they haven't rolled that into this year unfortunately. But yeah, a lot of the alcohol care teams nationally are doing the fibre scan clinics, and we're lucky to have 2 clinics on. So yeah, it's all about early detection and prevention.
Yeah, I suppose it's just picking those things up as early as you can.
Yeah.
And it doesn't even have to be, I suppose, a patient who necessarily has that issue who comes in. We're just picking something up. They might be in for something else, and we're picking that up when they're in.
Yeah, and the attendance is quite good on the clinics, to be honest. We had some figures back the other day from how many have attended and how many have DNA'd and how many we've referred on for like a consultant gastroenterologist to pick them up, and it's a third, which is quite scary really. But these are the patients that we haven't picked up prior to us being in the hospital.
It sounds like there's lots going on and lots to be excited about over the next few months. So
yes, thank you.
Hopefully, hope we can get you back on the podcast in a few months' time and find out lots of new developments, because it all sounds like it is changing very quickly. So thank you a lot for joining us.
Thank you very much.
Yeah, we'll hear from you soon.
Thanks.
Thank you for joining us. Till next time, you've been listening to NTH Voices.